All right, and we are live and welcome to another live chat discussion with Counselors in the Community Association. I am Jacqueline Stevenson, the Executive Director, and I am joined by two phenomenal therapists that are going to introduce themselves in 1 second. Today our discussion is going to be on therapy. We want to address the stigmas as well as the questions that we commonly hear as it relates to going to therapy and just the therapeutic experience. So let's dive into the introductions. Who's going to go first?
Amanda.
Uh,
Not sure those are the rules, but okay. Good evening. My name is Amanda McIntyre. I am a licensed clinical social worker. I also have my master's in divinity. And I specialize in just supporting young adults, helping the young adults navigate kind of what we call adulting. I
hmm,
like to work with trauma. I like to work with grief. I like to work with self-esteem and identity. And my thing is kind of supporting people as they navigate all of those difficult things. Because as long as we're breathing, life is going to be happening. And I also like we need a safe place to kind of connect while life is happening. So that's it.
Thank you, Amanda. And Miss Jesaira.
Hey, everybody. I'm just Sarah Glover. It's amazing. Amanda and I share so many of the same things. I am a licensed mental health therapist outside of Georgia and founder of Create Your Own Oasis LLC. And I consider myself a skilled facilitator to help individuals deal with transition and loss and grief of any kind for individuals and couples. Very much so, like what Amanda mentioned, I really endeavored to create what I call safe spaces as people navigate change like never before. We're seeing that as a result of the pandemic, and people are dealing with depression and anxiety, trying to figure things out. And so that's kind of what I focus on, in addition to working with women and helping them to find their voice, specifically women of color. I'm glad to be here tonight.
Thank you so much, Jesaira. And now we are going to go into some of the commonly heard. So, ladies, from your perspective, right? What are some of the commonly heard stigmas that you would like to maybe just address before we get into some of the, commonly heard, like, oh, therapy is for white people and things like that?
One thing that I often kind of experience and run into is people thinking that you have to be, I'm not going to even use the C word, but like something has to be terribly wrong for you to go to therapy.
hmm
And I think we kind of operate from this space of why do things have to be wrong? Why do we, it doesn't have to be a crisis intervention. Yes, crisis intervention is one thing, but we don't have to wait till it gets to that place.
Mm,
Like many of us don't go to the doctor just when something is wrong. Some of us do, but we also have our wellness checks, our annual routines just to ensure that nothing goes wrong and kind of these checkups. So if we can kind of get to a place of understanding that everything doesn't have to be a crisis, it could just be a part of how you take care of yourself, is a way of seeking therapy.
absolutely. And, I feel like going to therapy or wellness checkups should also be an annual thing for mental health because our minds are the most utilized organ
Mm-hmm.
Absolutely.
every day, all
Absolutely.
day, and it gets burnt out. It goes through its experiences as well, just as our body does. So I
Yeah.
feel like mental health needs to be a annual wellness checkup.
Mm-hmm.
I really do.
Yeah, and it's interconnected. So, we definitely have the mental, the body, and then the spiritual component, all of it wrapped in one. And so to be able to, yeah, definitely facilitate wellness checks around your mental health is important.
Absolutely. So some of the commonly heard um, phrases is therapy is for white people. So let's pull up our little meme we have for this, right? I didn't think you believe in therapy. I don't. It's for white people. And Amanda, you mentioned something very powerful during our prep meeting about the access.
Mm-hmm.
You know, and ancestral wise, like they didn't have this access. So of course it was perceived that, therapy is for white people. And I guess that just continuously lingered on. That struck me when you made that statement.
Because I think a lot of things that we name for white people or women, or even if whatever we look at, we name dance or gymnastics is for girls until we see males engaging in it, right? And I think the same thing happens. That's what access is. If you don't see something, then you don't feel like it's for you. And so people not having access to mental health, and we're African Americans and we're looking over there and we don't do that, then it's not for us. But until we're given permission or resources or access, I mean, we could do the same thing with education, right? At some point, our ancestors were probably like, college is for white people, right? And is that the
Mhm.
truth, or was there just no resources or no access to it? And so I think education, information, resources kind of enlightens, like, hey, maybe this is something that we could engage in or benefit from.
Absolutely.
Yeah, I love that.
Another, I can't afford therapy. I should probably go to therapy, but I can't afford it. And it's so many people with those sleepless nights that may feel like that they cannot afford therapy. And there are so many resources out here available for people that take that take public insurance, from medical assistance to the sliding scale, like you mentioned, Jesaira.
Yeah, absolutely. The sliding scale open path collective that actually is available for individuals who make $100,000 or less to have access to services, because that is an ongoing issue that we're seeing. So it's along with what Amanda is saying, having accessibility, but then how do I get access to now what we're normalizing? So these are some of the resources. The other thing to keep in mind is that there are many therapists who not only offer sliding scale fees, but some do pro bono. So that's important to keep in mind and to know, because a lot of people don't know that.
Mm-hmm.
It's good information to have access to.
I think your meme said, I think I should go to therapy, but I can't afford to. And the truth of the matter is, sometimes we can't afford not to go to therapy, right?
Absolutely. Absolutely.
So
Absolutely.
it's kind of like therapy will cost you, but not going to therapy might cost you everything. Um,
Absolutely.
That's so true.
so one thing to kind of keep in mind, all the resources that Jesaira spoke of, but you may not be able to afford individual, right? Individual can be a lot more expensive, but a lot of times
Group.
groups may be
Yes.
a whole lot more financially feasible for you. And while it won't maybe get to some of your individual stuff, there is so much support and mutual aid. There is
Yes.
such a
Yes.
therapeutic resolve or relief in, oh my God, Jackie, you've been through that too. And how did you get through that? And how did that help? And just
Absolutely.
again, having a safe place to land or a community. So even if you can't afford, or you get to a therapist and you consult with them and their fee seems, like you can't afford it, ask about groups. Do you offer groups? Check into community centers. Are there groups? Are there local resources that offer support groups? Different things, but groups are definitely something you can consider.
Yeah, so as you said, you may not may can't afford to go to therapy, but not going may cost you more, and that's
So
a
true.
whole level
That's
right
that's,
there.
that's so true. And that's really just to add to it, prioritizing
Hmm.
your mental and emotional well-being, not putting it off.
Absolutely.
We have made our emotional, our feelings, we've placed that and put that on the back burner because we haven't
Yes.
seen the value in it. So that's very, very important. The groups can definitely offer that as well. I love that. Love that.
Hmm.
Love that.
Yes. Another commonly heard is therapy isn't for me.
Yeah. Yeah.
It's not. So, it's not for no particular person. It's not just for people who have mental disorders or people who are going through just different things. Sometimes you might want to go to therapy just because you need to untangle some things,
Yeah.
detangle.
Something that's coming up as you're talking that Amanda mentioned with regards to our ancestors. So if we talk about being marginalized and marginalized people of color, one of the things that we've been taught in many instances is to pray things away, right? To spiritualize things. And we're
Mhm.
not taking away the power of our spiritual experiences. However, there are some things that we have to be able to process and talk out. And we
Right.
can't be afraid of having those conversations and saying, oh, demonizing therapy from that perspective, but rather engaging it as a resource to help you to heal, you know,
Mhm.
as a resource to help you to gather information about yourself that
Mhm.
you otherwise wouldn't know.
I love,
Absolutely.
yeah, I love the fact that you brought up, spirituality. With my master's of divinity, I've been able to engage and explore and study that a lot. And that's one piece I find people, and I am so grateful that it's changing, feel like, you can't
Yes.
believe in God and go to therapy. Like these
Yes.
two things can't coexist. And you said
Right.
something like demonize it or spiritualize it and just pray about it. But I'm wondering how we can get to a place where we embrace both because we pray for
Absolutely.
people with cancer, right? But they still go to treatment,
Right. Right.
right? And so
Absolutely.
I think the big thing now is you can have Jesus and a therapist, and I think that's true because at the end of the day,
Yeah.
God wants you healthy, God
Yeah.
wants you well, God wants you whole, right? And
Hmm.
so I believe any resources that's going to allow you to get to that
Yeah.
will be beneficial.
Absolutely.
Absolutely.
Definitely a combination. Yes.
So as we get ready to dive into that therapy experience, I want to break down, just bring a little image in. Some of the things we experience and go through in our head, it feels like it's just a maze. Sometimes we can't just put it all together or figure out what it is. Sometimes it keeps us stuck to where we feel detangled.
Mhm.
We try all these declutter options like, meditation and, reading books and, we try all the self-help methods. And, sometimes we still get in that middle space where it's still a little twisted here. Now we've separated it a little bit, but we still can't figure it out,
Mhm.
and that's where therapy comes in for
Mhm.
me. I feel like having that professional who is skilled to recognize, just commonalities and signs
Mhm.
and symptoms, just like your doctor is able to do.
Mhm.
Therapists are skilled and trained, just as medical doctors are skilled and trained. It's
Mhm.
a technique, and it's a very, very beneficial technique that can help us work through and detangle some of that clutter that we are going through. Just like Amanda, what you mentioned, um, one day you didn't feel like it, and your therapist saw that as an opportunity, like, well, let's talk about it.
Mm.
Because it doesn't have to be that deep to
Mhm.
go to therapy. It doesn't have to be that deep. So now we're going to dive into this therapy experience, right? So the selection process is the first place to start. So, Jesaira, take it away. We're going to start with this nice little meme.
So I love that meme. Yeah, it's a match. So, you know, selecting a therapist can be a daunting experience. Where do I start? Where do I turn? And it can feel like, oh my God, all of these tools, but not knowing what to do with it. So part of the selection process is first, knowing what your financial options are. We talked yesterday a little bit about, do you have an EAP program? Do you have SHA? Knowing exactly what you have access to, and then researching the providers, actually using your insurance to find out what therapists may be available, and then use that as a guide to figure out, does this therapist meet some of the needs that you may be looking for? What is their education? What is their background? What is their specialty? What about the personality? Does their personality seem to jive with mine? Does it appear to be a match? It doesn't have to be as daunting, but I definitely love the fact that we want to acknowledge that it can be an overwhelming experience, but there's ways that we can kind of approach that in a non-intimidating way.
Mhm.
Absolutely. And we have available resources that can help us in selecting a therapist, such as Psychology Today. Psychology Today is a resource where you're able to search for therapists. You can also do a little bit of their see a little bit of their history, their background, and all of these resources that we're offering is going to be posted inside the chat if anyone needs to or wants to take a look and check it out. Therapy Den. Can you go into that a little bit, Amanda?
From my experience, Therapy Den is one of the directories that's supposed to be more inclusive. And so you'll find a lot of therapists if that's kind of what they want to be known for. They want to make sure they reach to make sure that you feel included. So that's kind of a resource that a lot of people look for in that. It's just a matter of literally Googling. I'm not sure if the website is therapyden.com, but literally you can just kind of go on there and you can literally select every option that might be important to you.
Yes.
Gender, sexuality, ethnicity, like, and then different things that you may be wanting to address. So they really, when they say inclusive, they really try to look at the whole entire picture.
That is so true. That is the bedrock of their vision.
Mm-hmm.
Yeah.
And then we have Therapy for Black Girls. That's another very useful resource for African Americans who are, or even, any other nationality that feels like they want to better connect with a different, therapy of African descent. It's not just for Black girls, because the therapy experience is about the client getting what they need from the service, not specifically trying to single out, one race from another, as well as Black female therapists. All of these resources, again, are going to be inside the chat for resource.
Another one that stands out of my mind is Clinicians of Color. That's another good one.
That's another good one. Yes.
Absolutely.
And once you go on their directory, you can either put a zip code or even go by state and kind of go through there.
Absolutely. Clinicians of Color. That will also be inside the chat for resource. And, for Latina community as well, there's Latinx therapy available that allow you to locate a therapist that's Spanish speaking and available for your community as well. So mental health, we have resources for every single individual that may need it. Affording therapy is no longer as big of a challenge as it may have once been, So the selection process is really just about knowing your financial options so that you understand where you stand as far as, do I need free resources? Do I have employee assistant program, which is that EAP that was mentioned through my employer? And, am I paying through my insurance? Because not every, 99.9 probably, I'm sure, are offering mental health financial support. So that's, it's a lot more accessible these days. Next, we're going to go into the connection. This is important because it's establishing trust is the most important part of the therapist's concern with their client. And I want to allow the therapist to go deeper into this connection process and really just the therapy experience.
Oh,
it's our little me.
Amanda, do you want to start? Do you want me to start?
Go ahead, you got it.
That is so funny. For me, establishing a place of trust starts with first building a rapport, making the client feel comfortable, safe by not judging them, and making them feel as if what it is that they are experiencing is validated and heard. And so it is a collaborative process. And I refer to it with my therapy, with my clients, as a dance. There's times when it ebbs and flows, and sometimes I may lead and sometimes you may lead. But the basis of our work together is the relationship that we build. We're both vested. We both care. I care about your well-being, and you know that I care. And that's a process that happens throughout the entire time together. It evolves over time. It also changes. I guess with the evolution, it changes. And many times that allows for the client to explore in ways that they never thought that they would explore when they know that you care. when they know that you care, they will engage, and it will make the process not as difficult, but it's ongoing.
Mm-hmm.
Sure.
Mm-hmm. Now, Amanda, no, you have to go into this because
So I love this meme. Like you see this meme for like everything, right? But I think it represents therapy a lot because sometimes people think that, it works both ways because sometimes people think
Yes.
that I just talk and they didn't say anything. And sometimes we're like, this is your time, this is your space. What are you gonna talk about? Like, how do you want to use this time today? And so it's kind of, I'm looking at you looking at me. Like that shouldn't be happening in the therapeutic process. It should absolutely be a two-way street. And sometimes it's gonna be a one-way street with just the client. Like sometimes they just need that space you, Jackie. You're a mom, you're a wife, you're a professional, you got all kinds of things going on. Let me ask you this outside of the therapeutic space, when have you ever had 50 minutes just to focus on or talk about you?
hello.
Yes, say it, Amanda. Yes,
Yes.
yes, yes.
Yes.
That
Like
part. So right.
it's so interesting. And here we are. We've craved out this time. When we've carved out this time, you've made this appointment, you're spending money, you're spending, investing in a copay, and use this time to just talk about you. It's so interesting, particularly for women. And if this doesn't seem inclusive, I apologize. But from my experience, right, with working myself and with, just women, on the first appointment, you're like, tell me about yourself. You know what women do? You mean my kids?
Talk
You
about
know,
it. Talk about
you
it.
mean my wife, my husband?
Yes.
No. You mean my partner? You mean my job? No,
Yes.
you.
You.
What do you mean? I don't understand. What do you mean? You need to give yourself permission just to focus and talk about you. And it's so funny. So that's like the first appointment. Then by the third appointment, it's like, oh, and let me tell you about it becomes when somebody has made time and space just for you to show up, it's
Yes.
like, I
Yes.
want this again. I want this. Well, what about me? And then when you start to try to engage in other things, they no, back to me. Back to me. Just highlighting the fact that people need time just for
Mm,
them. We
mm.
talk about self-care, right? We are really good with buzzwords, really
Hello.
good with social with buzzwords, right?
Yes, yes, yes.
But what does that look like in real time? And what does that
Mhm.
look like personally for you?
Mhm.
Therapy is self-care, right? And here's
Self-care.
what I know. When people are able to
Yes.
engage and know themselves and have time to think about stuff for them and have this non-judgmental space,
Yes.
they are able to show up so much more full in the other area. They are able to be much more present in the other areas of their lives
Yes.
because
Absolutely.
it had that release,
Oh,
right?
I love it.
It
Woo!
has that release. So they can show up fully as a mom. They can show up fully as the CEO. They can show up fully as the spouse or fully as the dad because I don't want people to
Yes,
come.
Amanda, come
Yes.
through. Come
But
through,
yeah,
therapist.
Yes, no, I love that. And I love that she did mention men because I'm noticing the last couple of years more men have been engaging in the
Yes.
therapy process and they recognize that there is a space or that they need a space. And
Mm-hmm.
it's wonderful for us to create that for them as well and to understand how that also plays in helping the family.
Absolutely.
Just so many benefits to that. And so I'm so happy you mentioned that because that has been on an increase, more male clients.
Yes.
For
yeah,
So
sure.
we are the selection process, finding
Yes.
a therapist, knowing your financial resources, researching into providers, right?
Mm-hmm.
That's the first step. Then making the connection once you do find that therapist that you feel like, okay, I want to try to do this, I'm ready to do this. Making that connection, understanding that it's a collaborative process and we're going to communicate together. And I'm here to support you. This is your hour. Like Amanda said, this is your hour. Now we want to understand this is the most important.
Mm,
Establishing goals.
mm.
Come on, take it away, therapist. Let's do this.
I'm gonna let Amanda go first this time.
I just finished.
Hey,
Oh,
what
okay,
you
okay,
mean?
you did just finish. You did. Okay, yes. So, wait a minute.
What
This is
I
your
mean?
well, establishing goals. First of all, you have to be willing as the client to put yourself out there and to be vulnerable. That comes from, of course, building the relationship and fostering the therapist, fostering that trust. So what do I want to work on? What is my goal? What are the tangible things? What should I be seeing and noticing as a difference when I come into therapy? So if I came into therapy because I've been having depressive symptoms or been feeling sad, hopeless, not liking myself, can I go back and say, can I measure the fact that now I don't feel as sad anymore? I feel less anxious. What can you go back to after we've worked together and say, hey, I can see the improvement in myself and others can see the same. The establishing of goals actually help to kind of provide direction and guidance for the therapeutic experience. It's not just shooting from the hip, but we're providing some guidance as to what's next and what we should be working towards. I hope that helps.
Yeah. I think I love the guidance that you use. And here's the thing, like everything we're working at, how are we going to measure it? So one thing that I often experience is, and this is not a judgment, this is just giving voice to the experiences, right? When I meet with people and I do my intake and my assessment or my consultation, and there's always this question of, have you ever been in therapy before? Because that's informative. Like, did it work? What didn't work? What do I need to, I cannot go there because you're going to leave. Like, I need that information. And often it's like, yeah, I've been in therapy before. Well, was it helpful? No. Okay, that's fair. Like, everyone's not a dope therapist. I get it. Well, tell me a little bit about, was anything helpful? No. I just didn't feel like anything worked. Well, what were you working on? I don't know. Well, what led you to therapy? I don't know. And so oftentimes, if we don't have an idea of what we may be working on, then of course we're not going to feel like it's working, because what was supposed to work?
Hello.
Right? What was supposed to work? And then as a therapist, I try my best to stay away from the word why. And if any of my clients out there and I say, why do you don't call me out? But like, I try my best not to use the word why, because I feel like it backs clients up against the wall. Like, why you do this, Jackie? Why you do this, Jesaira? And then so I always kind of use the term what, right? And so in therapy, I really want to encourage you as you're engaging in that process or even thinking about it. What's your what? Like, what brings you there? When you make that phone call, when you go on that directory, when you respond to someone, their email, I want you to think about what, because here's the thing, we think about it a lot. I'm going to go. I got to get the kids through soccer, then I'm going to go. I got to finish this final paper, then I'm going to go. I got to get this promotion, then I'm going to go. It's always we're going to go. But when you finally send that email, go on, clinicians of color or Black female therapist, something is happening in that moment to finally make that push or that go, right? Yes. And so I always try to ask you to keep in mind, what was the what? What was the what that finally made you say, enough is enough? Because sometimes, here's the thing, when you're really hurting, I think the pictures that you use and you kind of discuss, kind of depicted like there's so much happening, there's so much going on. And I will give us grace for that. Sometimes when you are overwhelmed, you cannot articulate what you want, what you need, what's happening. It's just a lot, right? But going back to that moment when you finally made that call, something generally happened, right? And it wasn't like that's the first time. It's usually like the straw that broke the camel's back. So what's your what? What is that thing that, you know what, I'm making this call today? It's one thing to make the call.
Yes.
It's two things, right, to actually follow up, because we play phone tag, we doing emails. It's a whole nother thing when you finally show up for that first appointment. So keep those things in mind. And that's how you kind of commit to treatment.
So we have a wonderful question. It says, ladies, how do you shift through the therapist that has unresolved issues and trauma themselves? Can they effectively help the clients deal with their own traumas and unresolved issues? And are these kinds of therapists good for therapy? Do they really help? Oh, did he go deep? Oh,
I know that. Oh my gosh.
Okay. Jesaira, take it away.
Oh, that is so loaded. Oh my God.
Let's break it down sentence by sentence. We can work through it together.
Yeah, let's work through it together. Well, first of all, I want to say this and put this out because I think this is an important part of the process, which highlights the collaborative nature. Your therapist is a human.
Mm-hmm.
Your therapist is complex, and your therapist will not always hit the mark, right? So kind of understanding, not expecting perfection from the therapist out the gate might be a good way to manage your expectation. One of the things I do with my clients is when I'm having an off day, when things are not like they seem, like they should be, I will bring it into the therapeutic space and acknowledge it because I'm modeling vulnerability, and I'm modeling that it's okay not to be perfect. It's okay to show up authentically as myself.
Absolutely.
I don't have to always be on. Okay. Now, having said that, I also recognize my ethical responsibility that if I have not done my work, that then my trauma, if I haven't resolved my trauma, that I might need to back up and do what I need to do. As a therapist, though, I should always have a therapist. So I have a therapist, okay, that holds me and keeps me accountable so that I'm not bleeding, so that I'm not projecting, so that I am holistically, like in a whole space as I'm holding the space, that I'm in a whole place myself. Okay. We have to acknowledge when we're not in that space, and we have to know our limitations, and we kind of know when we are out of pocket in terms of, I can't hold this. I'll share an example, really brief example of someone came and I was working with them, and they were dealing with some intense, some molestation. And at the time, it reminded me of something that I knew about concerning a loved one, and I was a bit triggered, right? I had to seek consultation about that, and I needed to get the support in order to continue to provide safe space for that individual. Had I not been able to get the consultation, then ethically, I probably should back up and say, I'm not in the space where I can work with you. I do think therapists are human. Therapists have good days, bad days,
Are
and
taking on so much themselves,
absolutely. And then, yes, yeah. And in those moments, though, in those human experiences, yes, I think we can help through modeling. I hope I answered.
You got it. I don't even have. Hope you got it, Robert.
But to sum that up is to say, just because your therapist may have their own traumas or what have you, they're still professionals.
Exactly.
And ultimately they know their responsibilities, just as the doctor when he's not feeling good himself, but he still may come to work even though he's not feeling too well, because he knows all right, I have my boundaries with this, right?
Yes.
I'm not going to come to work and I'm going to get my patient sick. So
Well,
I'm
there's
not
a spectrum.
But and also maybe it's just me. It was something particular about the language of that comment that made me question, is he speaking from someone who saw this with his or somebody else's therapist, or could he be speaking from a place of they may know a therapist personally who they feel like hasn't resolved their own trauma, and questioning if they have the ability to guide, or support others. And I think we have to keep in mind that we don't get to define someone else's trauma, right? So even as a therapist, I'm working with people and I hear things and I'm like, "Ooh, that's the traumatic event. That's the event right there." But if the client does not identify that as their trauma, then that's not the trauma we're working on.
That's right.
So even though there may be someone in your personal life or someone that you know from a distance who you're like, they got their own trauma, how dare them try to show up as a therapist? We don't get to say what someone's trauma is, number one, and number two, if someone has resolved their own traumas. If you're experiencing that in a therapeutic space, when you're there for that 50 minutes, or if it's couples, that hour and a half, if it ever feels like you are not the primary concern focus, then you have permission to say,
yes, permission.
I'm feeling like today, like for some reason, I don't feel like it's about me today. It feels like, am I missing something? Like, you can press pause. That is your time. And that also models, like, a lot of us struggle with being assertive. that models this is your time. You get what you need in that time. And if you have to, what's this word I'm looking for? Um, break up. That's the best. I can't think of another word right now. Terminate. If you have to terminate, fire, choose another therapist, then that's okay. Because
Yep,
this is the one time in your life. If you can begin to, therapy can sometimes be modeling and practice. If you can
Yes.
begin to make your own choices and assert yourself and use your space and show up fully in therapy, it empowers us to be able to do that outside the therapeutic space.
absolutely.
Yes.
Absolutely. Wonderful. Wonderful. So, again, let's run this down. We have the selection process, finding a therapist. Then, once we find a therapist, we make that connection. We establish some trust and, have an open mind to the process. Then we establish some goals. Like she said, what's your what? Why do you feel like you want to be here? What would you like to receive
Mhm.
from this? And now committing to treatment. Come on, we gotta do the work. Like this little me therapist. You need to let people in. Me is not locked. So come on. Don't say the door isn't locked, but then you got, nails and spikes and cactus bushes all around it where you're not really opening up.
Yeah. I talked about how starting therapy can be very much so like beginning a workout regimen where you're working muscles that you've never worked before. And initially, it can be very challenging to pick up that 10 pound weight and to do those lifts, those arm lifts. But eventually, if you continue to do it, the easier it'll become, but you're also strengthening yourself, right? So if you give the same commitment to therapy and then recognize even when you may hit a plateau in therapy or when you get to a point where you feel stuck, to go a little deeper through consistency. Maybe we dig a little deeper. My therapist is asking me questions that before I would avoid.
Mhm.
As you practice, as you get more comfortable, as you exercise this muscle, the easier it'll become to engage and to be a part of the therapeutic process. And before you know it, your body changes, the formation changes, the way that you respond changes, your reactions change. You begin to
Mhm.
see the personal growth as you commit to it on a consistent basis.
Mhm.
Absolutely. Amanda, I definitely want you to chime in on the committing to treatment.
Um, a lot of times I know in my own consent paperwork and a lot of different clinicians that I know, sometimes there's a statement in the consent paperwork that in so many words says, we want you to understand that things may feel get a little bit worse before they get better, right?
Hmm.
Meaning that it's not this, in a social media age and a lot of the reality TV, some people have kind of invited us into their own therapeutic spaces and we get a lot of information, but all information is not accurate, right?
Hello.
And therapy is not, while it can be this beautiful experience, it doesn't always start out that way, right?
Mhm.
Like you are sometimes I think about from a medical model and my own experiences, right? And I don't know if you've ever kind of had a medical procedure, right? So here I am, I had surgery, and I'm thinking, oh my God, this is going to be the worst. This is going to be the worst. And I make it through the surgical process, right? And I'm like, oh, it wasn't even that bad. I mean, I was asleep the whole time. It wasn't. It's the healing, right? It's the healing that is
Yes.
difficult. It's the soreness. It's the inflammation. It's the you can't do the things that you want to do. This healing is hard. But what I had to lean into is that I knew I made that decision that because if without that, the quality of my life was greatly impacted. Right? So
Mm.
I'm gonna endure this pain, this discomfort, all of these things, reimagining my life at this moment. I can't go to the gym, all of these things, because I know at the end of the day, there's a belief system that I have that it's going to get better, right? And I invite that same imagery in the therapeutics process. Like you're
Love it.
literally picking at scabs and you got to pull this up and, we got to sometimes look over here. Sometimes clients will clearly tell me, not today, Amanda. And I honor that, but I can't let you say not today for the next 7 weeks, right? So even if you know what, last week you said not today, and I honored that. What about we talk about it for 2 minutes today? you give me the symbol, and we stop.
Yeah.
Right. And so breaking it down into small pieces, knowing that it's not going to be okay. And I come from a military culture. A lot of my background is military. And there's this idea sometimes of embrace the suck. Right. And that's what you,
Embrace the suck.
you
Yes.
embrace the suck. Like it's going to pass. You got to, and the difference about it today, while you're embracing the suck is for this 50 minutes, I'm sitting in this space with you. You are not carrying it alone.
Yes, you are not alone. Absolutely. We have a question. So, ladies, do you think therapy is always needed to work through childhood traumas? Or is it possible to work through them on your own? Wonderful question.
Hmm.
So, I'll start just to, because, you get the brainstorming. So, so I believe that you can work through them on your own. Now, it's lots of resources that's still required. One, you need to do some discovery as far as like looking up some self-help resources from articles, from other case studies for people who have gone through similar traumas, how they were able to recover from the similar traumas and, methods they may have used. So I believe that it is possible to work through them, but it's a process, and it takes skill and study. It's not just you know a easy process, really, because it all really depends on the trauma and depends on where you are with this trauma.
Mhm. So
Come on.
this is the one thing that stands out. One, thank you for your question. Thank you all for your questions. Here's one thing, I think you can probably work through anything on your own, but what does it look like, right?
Mm,
And one thing that I know for sure is like when you're in the middle of something, you see it from a totally different perspective than from the outside. And so if you're working through the language that you use is can you work through it on your own? And so I imagine you in this space, in this box, trying to work through some stuff on your own. But there are some people outside the box who have a different perspective, a different angle from seeing things than you're able to see it, right? And so one of my favorite quotes is, we see the world from where we sit, right? And so you're seeing the lens that you operate from is from some of your traumatic experiences, and you
mm,
can work through them. You could work through them. But if someone from the other side, whether it's a therapist or a close friend, they're going to see some things that you may not see
absolutely.
and may be able to help work you through. I always envision kind of being like at a Beyonce concert, right? And me, Jackie, Jesaira could all be at the concert. But we all are in three totally different places, right? And we're all living different places in the world. So I can't think of a stadium that we might all know. But somebody might have front row seats. Somebody might be like an orchestra seat, and somebody might be way in the nosebleed. We're all at the same concert. But guess what? We're going to have a totally different experience
Woo!
because of where we're sitting, because of where we're coming from. And I think that's the same thing with kind of your question. Could you work through it on your own? I think we can work through anything on our own. But what
Mhm.
will it look like? What's in
Mm,
front of you?
Yeah, I like that. And just
Love
to
it.
add one more thought to that, could you absolutely, is it advisable from a
mm.
clinician perspective? No, I would not, because of what Amanda just stated, and because depending on the complexity of your trauma,
Mhm.
there are some things that you may need some assistance outside of yourself.
Absolutely. Absolutely. We have another very, very, very interesting question. So, how do you deal with clients that are constantly coming to the session speaking on the same topic? How do you find ways to help this person heal? Because if a person constantly talks about a topic and it becomes repetitive, it's very damaging. So, how do you help them overcome the topic?
Hmm, that's a very interesting question. Thank you, Chantel,
Mhm.
for the question.
So
Go ahead.
go ahead, Sarah.
Go ahead, Amanda.
Because I was going to say one, and again, I think it's very important to keep in mind that every therapist has their own therapeutic style, right? And with therapeutic styles, we have therapeutic frameworks that we operate in. Some frameworks that would not work, and a therapist will be like, So what do you want to do about it? So
Me
we've
too.
been talking about this for 3 weeks. What do you want to do about it? And that
Yes.
works for some people, right? But I think number one is understanding your therapeutic style, but still going back to the very beginning and what Jesaira, talked about is the relationship. At the end of the day or the beginning of the day, right? Everything is about my patient. It's not about me. It's not about my skill set. It's not about my credentials. It is about the patient. And
Mm-hmm.
if that's what they feel like, I don't get to quantify how much somebody can bring something up.
Mm,
I don't get to say, well, that's the eighth time, I don't know. What are we going to do with it now? I think it's about, I love the imagery of the dance, right? And it's about what is this? I think one of the biggest things about therapy is people are like, I want to go to therapy because so I can get these answers. And therapy is not always about the answers. Sometimes it's learning to live within a question, right? And
Yes.
so
mm,
even,
Yes. The great.
even
Yes.
if you present it, Chantel, if you say there's a way that you can present that to say, we've been talking about XYZ for the last three sessions. I'm wondering what you really want to do with that, right? I'm wondering if you want to move forward or you just like having this subject to talk about. I'm wondering if it would be feel like more work for you to actually work through it and it's just easy. Or I'm wondering if you want me to confront or ask you when we're going to stop talking about this, right? So it's literally just really depending on the patient. For me, it always goes back to what brings them here. It goes back to kind of what our therapeutic relationship looks like. It goes back to where we are. Can I confront them now? If I confront them, they're not going to come back. So that's kind of, you said something about if it becomes repetitive, it's very damaging. And I don't know if I 1,000% agree. I absolutely understand where you're coming from, but I don't know if I 1,000% agree with that. Agree with that because the repetitiveness could be the foundation for being prepared to talk about it. I mean, to be prepared to work through it. So I'm
mm.
bringing it up. I want you to hear it. I want you to see it. I want you to know, but I'm not ready to go there 100%. It's like the
Absolutely.
student that's like showing up in class but don't really want to do the work, but they there. If they're showing up, that says something, right? And so just kind of again going back to just there dancing with that.
So another question before
Mhm.
you dive in, Sarah.
Uh-huh.
So for that same scenario, right? What
Mm-hmm.
if the client themselves finds themselves struggling with that same thing and they feel like, I'm going coming to therapy, I'm saying this same thing over and over again. You're not really, I don't know if you're getting it. I don't know if I'm getting it. Maybe we're not either getting it. Right? So it's like maybe the client or the individual wants to understand like what other resources are available really, or what should my therapist maybe be recommending to me where I'm not feeling like I'm stuck in this same thing every session where I'm asking and wondering and trying to figure this same thing out. How do I figure this out?
Mm-hmm.
Well, one thing I want to add to what Amanda said, and then tie into what you're saying, Jazzy, is this. We have to be patient with ourselves. So
Beautiful.
the therapist models patience as they continue to hold the space, and then they encourage the client to be patient with themselves because there's some things that you just cannot work through in 6 months. If it's been a part of you for 16 years, it's not going to dissipate in 6 weeks. All right. So it takes, some things literally take time. I'm
Mm-hmm.
thinking and reflecting, very good question. A client just brought this to me today in the session, right? Their concerns about, I think I'm talking about this X, Y, and Z a lot. Well, what I did was, as the therapist, reflected back what they said, but I also reflected back their growth because they
Beautiful.
didn't see, they didn't have the ability, like what Amanda talked about. You're in it, right? So sometimes you're in it and you have the inability to see just how far or just how much you've advanced. So here
Mm-hmm.
it is, I'm talking to you, and maybe now you're talking about it from a different vantage point. You're continuing to talk about it because you still need to resolve it,
Mm.
but you have grown. Okay. If there's some anxiety, I found out with some of those clients, there's times when I have to do what is called body mind connection work, where I
Mm.
teach them how to tap into physiologically what's going on with them through various principles, various modalities, so that they can begin to move, because sometimes it's in the body and it's being
Yes.
held on in the body. And so releasing it out of the body, you feel it. Your unconscious self is bringing to your conscious self this awareness that some more work needs to be done. And it may not be talk therapy. That's okay. So it's that dance discovery. Does that make sense? Does that
Makes perfect sense. And
Absolutely.
to add to that really quickly is I think that sometimes we don't recognize when our stories have changed. And sometimes that thread of whatever, I think it was Chantel, forgive me, that this person may continue to bring up may be the only way that they like. It's like we say these things, we use these words, but they mean something else. And that might
yes.
be the only way that they can tap into something else. Or it might be, if I bring this up, then I'm heard. If I bring this up, then I'm seen as vulnerable. Or so just kind of understanding that our stories change and giving people permission to change their stories. But then the specific question is, there are all these different modalities that we can pull from and lean into. And you don't necessarily know which modality to tap into until you know that patient, you know the goals, you know their strength, you know their growing edges, so that you don't want to hurt already hurting people. So you have to dance very or tread very lightly.
And another part of this therapeutic process, we got the committing to treatment and then being open to the tough stuff. Like you said, it's not always going to be pretty. It's not, it may be some tears. It may be some, but you don't know what the hell you're talking about. And then you reflect on it when you leave the therapist, like, man, she probably was right, and it's all good. It's a collaborative process, and it's all about you, the client, and most importantly, applying that self-work. Apply the self-work. If you're not doing that homework, it's how are we connecting the dots? How are we connecting the dots? We're agreeing to this here, and we've agreed that, based on what we've been discussing, that this is the next steps, right? And I should see you in another week or 2 weeks, depending on the treatment plan. And I'm expecting you to apply that self-work because it's for you. It's to help you.
I want to add something to that
Please do.
I think is important as it's coming up for me right now. As I work with my clients, one of the challenges with applying self-work is the environment and not having a support system. I just want to undergird I want to undergird the importance of course, applying it, but also finding your tribe that can undergird you and can help you as you apply and as
Yes.
you practice. And that's important to have that. It may not be family members per se. It may be other people, friends, but having that network of support will also increase your chances and the likelihood of you being successful in treatment.
Absolutely. Absolutely. So we have one more question before we wrap up. So just to round up the therapeutic experience, we have the selection process, finding a therapist, researching into your therapist, and, just understanding your financial options so that you can receive the best treatment and consistent treatment, because consistency is important. Making that connection, being open to the communication, the process, having an open mind, and trusting that process, because it's confidentiality and you have so many rights and protection in this firm, in that space. It is for you, you know, establishing the goals. Know what's your what, right? Establishing goals so that you have something to measure, reflect back on and understand where you've grown, where there still may need work, and where you're able to apply even that self-work. Committing to treatment, because consistency is key, right? Committing to treatment. Be open to the tough stuff, because everything isn't going to be pretty. And we want you to get the best, the most effective treatment. And all of this is required for you to get that, really, and then applying that self-work is so most important. So we have one more question, and I it's sensitive, but I'm gonna go ahead and do it. I'm gonna go ahead and do it. So, ladies, do you believe that Black therapists are good for Black communities, better than Caucasian therapists? And if so, why or why not? Me, myself, I do not I feel like it's all about the client. Not all African American clients feel more comfortable connecting with a Black therapist. So me, I do not feel like they are, better than Caucasian therapists because, every therapist has their own techniques, right? So we're not going to say one is better than the other, although, we have our favorites and that's okay. But, that's my why and why not.
Robert, Robert be coming through with the punches. Okay, Robert. I love it. I love it. I'm in the same line as you, Jackie, but I think I don't know if it's a matter of better or worse, but I do know that it depends on what's going on. If
Mm-hmm.
you're working with someone who's experienced some racial trauma or doesn't feel like he or she has ever been affirmed in their blackness, I think that
Mm-hmm.
seeing an African American therapist or a therapist of color kind of breaks down some barriers from the beginning that may not, or that may take a while to be broken down with a Caucasian therapist. I wouldn't dare say you're Black, you need a Black therapist. Everyone doesn't need that. I think what you need to know is kind of what you feel like you need a
Mm.
therapist, right? And you may start one way and then because I've known people who have gone, with a Caucasian therapist, and it was wonderful for them for years, or a lot of positive outcomes. But then when some racial trauma stuff came up, or
Mm-hmm.
when we started dealing with some of the stuff coming up socially, George Floyd and a significant amount of other people that we lost in that way, those
Absolutely.
therapists were not able to show up for them that way. And even if those therapists were in their mind showing up for them, if the client wasn't perceiving it as showing up, if they were even, because sometimes race, like you said, race can be a sensitive issue,
Mm-hmm.
right? Race can be a very sensitive issue. So if clients are not even able to talk about that, sometimes the code switching or changing your language, it can be a lot. And oftentimes I've noticed in my work when I work with people who've had experiences before, sometimes when you get in those situations, the client unfortunately ends up feeling responsible for taking care of the therapist, right? So when a Black person shares, oh, and this happened to me, and then this happened, and can you believe my boss said this? And then the white person, at times, the white therapist has been like, oh my gosh, I can't believe it's been that horrible. And then the Black client has often felt, now maybe I should take care of it. Now I feel bad for them. How they kind of say like weaponizing white tears, right? But like
Mm-hmm.
that whole conversation. So again, I go back to what I said. I don't think it's a matter of better or worse. I think it's about what that client feels like he or she may need.
Absolutely. I love that. Mm-hmm.
Okay, so I'm gonna add a different perspective, a spin on
Bring
it.
it up. Bring it
Let's
up.
go.
So I believe I believe representation matters. And as I read the question, I see it slightly different. I see it from a theoretical perspective. Is Black or are Black therapists good for Black communities? My immediate answer is absolutely. When you talk about effectiveness, because if I took that further and said are Black therapists most effective in treating Black clients? Maybe not always the case. However, from a very therapeutic, from a theoretical rather, and a systemic perspective, Black therapists are good for the Black community more so than a Caucasian therapist because of the issues and the topic, the things that Amanda has brought up. And when I look at the work that has to be done, one of the things that matters most when creating the space is that the client feels like they can connect with you and that they can build a rapport. When a Black person comes in a session in a space with me and they can say and be themselves, it makes it so much easier for them to authentically show up. And so, generally speaking, my answer is yes. Are we always effective? Maybe not. Should we push the agenda that you have to work with a Black therapist? No, because it's up to you. However, do I believe that Black therapists are good for the Black community and needed in the Black community? Hands down, absolutely yes.
Wonderful. So this has been a very, very, very amazing live chat discussion. And I knew it was so well needed because there's so many stigmas and so many, just misguided views on the therapeutic experience that I most certainly wanted to give some powerful, valuable information to our communities so that they understand from the therapist's perspective the therapeutic experience and some things that they can go into therapy with better expectations or even a clearer understanding themselves instead of going into it with these preconceived notions. So some of the resources we mentioned again was Open Path Collective. These resources are going to be inside the comment section for anyone who may need them. Community resource, the Loveland voucher, they offers free therapeutic sessions. You have to apply for it. There's a process, but do not ever get discouraged. Please pursue it. Join a mental wellness community. NAMI, Counselors in the Community Association. NAMI is National Alliance of Mental Health. What is the I that I'm missing?
National Alliance of Mental Illness.
Illness.
Thank you so much.
Oh no, you froze.
I think she froze.
Woo! Am I back?
Yeah, you're back.
You're back.
Awesome. And then Substance Abuse and Mental Health Service Administration. They also provide tons of resources for mental health, substance abuse, and a host of other support services. And then we have these online resources to locate a therapist from Psychology Today, Clinicians of Color. That will also be inside the comments for, your view. Therapy Den, Therapy for Black Girls, Black Female Therapists. And I even want to add Clinicians of Color in here just so that is. Yeah, I did it, y'all. Right in the middle. Clinicians of Color, right? Latinx Therapy, Mental Health. Mental Health First Aid America. Because Mental Health First Aid, we also offer at Counselors in the Community Association. It's a certification training, and it's an education resource that allows you to understand mental health a lot clearer, get a better understanding. It's well recommended for organizations working with communities and families and parents as well, because it's an amazing resource. And I want to thank everyone who participated, everyone for their comments. Join us every last Tuesday of every month for a live chat discussion. Thank you again for your engagement. And please share this live chat with your community, because you never know who needs it. And, because mental health impacts us all. Every one of us have a mind that is juggling so many responsibilities, and it needs to be effectively cared for, just like our bodies. So again, thank you for engaging, and have a wonderful rest of the evening, everyone.
Good night. Thank you. Bye.